because I know a lot of people are watching. Some of you, I'll show you a little bit, just a little bit around. So you'll see that's our front desk. We do have a coloring contest going on and a lot of, kids stuff, but and Santa's coming. So we got Christmas here, but we got a place for the kids, Christmas tree. This is what, hot seats. So this is where people would wait for their appointment. This is the actual room. So when you do come in, and it's often when people have watched me on YouTube and they'll see the room, they'll be like, that's the room you filmed the video. So yes, this is where I film 99.99% of all my videos. But so we have a few other tables here. So that's for my associate. And then we also have a room here that helps with rehab as well. So we have these vibe plates. So that stimulates a lot of the muscles of the spine and really helps regenerate. But the key here is, and what really makes an office like ours very different, is not only some of the tools that we use. So you'll see this type of thing, which is it's an adjuster. So some people are used to this one. So you see my mess here. You'll see that we can tone it down depending on the age. So if a kid comes in, like a baby, stuff like that, we can bring this down, and it's just this little movement to help. But we do have this one, which is like the thing. When you come to this, is we do have an x-ray machine. So we are x-raying and we are seeing where the damage is on the spine. We're seeing where the stress is on the spine and ultimately what we need to do. This is a consult room. So people would come in, you would actually go in here, meet me, meet my team, and we would do a full consultation with you and really figure out what is going on. And then the other piece of equipment that YouTube, my studio, if you want to call it that, but patients will come in here and they'll get this scan. So what this is your hand goes in this one, and what we're doing is we're measuring something called HRV. So if there's pressure on we can measure that with this system. With this one here, what this is doing, it's got these probes, and you don't feel it, but what happens is we put this on your back, all the way up your spine, and this will tell us what muscles are, again, later, to really see what the difference is like. And then the same thing with this one. The only difference, this is a thermal scope. So this one is measuring up and down the spine. And what we're doing is we're measuring to see how much inflammation is on the spine, because if one of those joints is stuck and it's not moving, it's creating damage. It's creating pressure on the joint. And when it creates pressure, that scanner right here, specifically how much pressure is there. So that's what happens when you go into a chiropractor's office, especially for the first time. We're very detailed in the assessment, so we'll be able to see exactly what is going on and be able to come up with a very tailored plan for you, so we know exactly. No different than going to the gym and getting a trainer. You're able to know exactly, this is our goal, this is what we're trying to achieve, and this is how we're going to get there. So I hope that helps clarify. I hope you understand what it's like to be actually in a chiropractor's office, because this is what it looks like. It's not to medicine. I want you to understand something, especially if you're watching. Chiropractic is not alternative. It is not, because alternative means that would mean that we're trying to get the same goal as medicine, which in most cases is just pain relief. And to be honest, most people are coming in here because that didn't work. So our goal is different. Our goal is to get you to heal better, function better, get your body in better working order, and have a homeostatic effect on your body, so that way your body can actually heal. So that is really the difference. The inside out approach versus what we call the outside in approach. We're not trying to put something in your body. We're trying to get your body to wake up. So I hope that helps. I hope you got a nice office tour there. And I hope at least that helps shed the light. And so you know that, hey, if you go into a chiropractor's office, this is what to look for. Anyway, I hope you have a great day. We'll talk to you soon.